name is Chitra Maimongar, and today I will be sharing my internship experiences which I did in my home country, Bhutan. I did in hospital. The hospital name is Jigme Dorji National Referral Hospital. I did in Department of Pathology and Laboratory. So it was really fun. Let me share all of you how I enjoyed and what are the things I learned. So first of all, I start by the table of content, and for the procedures, I start with the phlebotomy, then have the blood bank, hematology, biochemistry, histopathology, cytology, and genotyping, and finally, I did in the clinical microbiology. Procedure, we have to get the document letter from university and submit to the hydroc department. I did in laboratory medicine and pathology, so I gave them the letter and they accepted and gave the approval, and I went to the LM lab manager and got the office letter to officially join as intern. The overview of the clinical laboratory, there are 7 units and I did in all the units. Phlebotomy. So it's the process of removing the blood and is also known as venipuncture. It is the procedure in which the needle is inserted in the vein to take the blood, used for laboratory testing, also done for diagnosing the blood disorder and also for collecting and donating. I started by checking the syringe, then tying the tourniquet and looking for the medium cubital vein, which is the most common vein we use, and cleaning the area. After that, I inserted the injection and drew the blood as per the amount required, and I removed the tourniquet and removed the injection and removed the syringe tip and put the cotton on. So if the bleeding fails to stop, we have to press the venipuncture site tightly for a few seconds and let the patient rest.
Moviment. Ouais, il faut d'abord. Oh, ele moviment não? Pela cidade que não. Come to mobile.
We choose veins over arteries because arteries, they are elastic and have thick rough wall and they pulsate, so it's very difficult to draw the blood. And for veins, they are less elastic, does not pulsate, and it's easy to draw the blood. And for the median cubital vein, we use it as the first preference, and then the cephalic vein because they are fuller, larger, and fixed. And if the suitable vein cannot be found easily, we have to loosen the tourniquet, massage or tap on the wrist or the hand and remove the tourniquet and ask the patient to rest or keep the hand hanging down so that we can locate the veins easily. For rejection, the valve or the blood collected will be rejected if there is inappropriate specimen container, inadequate specimen identification, inappropriate volume of blood, using the wrong collection tube, hemolysis or breakdown of blood, and improper transportation. We have to carry out the phlebotomy again. Drawing the blood, we have to look at the colors of the valve. If it's blood culture, it will come first, and it is used to detect the microorganisms. Then we have the blue valve. It's used for coagulation testing. It's known as citrate. And then we have the red valve. It's serum used in biochemistry, immunology, serology, and blood bank. And SST is not commonly used, but it's used in biochemistry, endocrine serology, and immunology. And then we have the green valve. It's sodium heparin, used in ammonia, heparin, lithium detection. And we have the purple valve, is known as ETA, is used in hematology, cross-matching. And for the last one, we have the gray valve, is the fluoride oxalate, lactate and blood glucose will be detected. And as you can see in the right picture, for the red and gray valve, we take it to the biochemistry unit, and if there is HbA1 present in the purple valve, we have to take to the biochemistry unit as well. And for the hematology, we use the purple and the blue valve. Donation is the process of taking out the blood from one's body so that it can be put in the body of a person who needs it. The criteria for donation is age should be between 18 to medications, had flu, had organ transplant, got rabies injection, heart patient, or cancer patient tested positive for HIV, hepatitis B, or C carrier. The donor cannot donate the blood. Screening tests, and it is mainly the also have to test the blood, and we use the Coombs test or antiglobulin test. So the irradiation to the blood cells is performed to prevent the graft versus host problem, and the leukocyte-reduced blood has been filtered to remove the white blood cells that contain the antibodies that can cause fevers in the recipient of the transfusion. So in order to prevent all this, we have to do the RH typing or the blood grouping. If there is certain antibodies, for here we use the Coombs test and is direct and indirect Coombs test. And after doing all these processes, finally as you on the right, on the bottom, it means the negative result, and if on the top, it means the positive result. Next unit, so it is the study of blood and blood disorder. So we use this machine for the CBC, complete blood count, machine and report, and all the information such as hemoglobin level, hematocrit level, eosinophil, lymphocyte, monocyte, everything is given by this machine. Here we carry out the ESR, which is the erythrocyte sedimentation rate. It checks the clotting time. So especially when doctor is doing the operation, if the patient has accident, so using the clotting time, it will be beneficial because for man and female is different and per person is different. And for male it's lesser than 15 and for the female it's lesser than 20. And the sedimentation rate key facts. A high sedimentation rate signals high levels of inflammation in the blood. So most people with autoimmune disease will have high sedimentation rate, but the test can help diagnose everything or specific diseases, and the sedimentation rate can help evaluate how well your treatments are working. After that, we make the smear, and for this we use the peripheral blood smell test that shows the blood cells and platelets in order to look under microscope, and it should be tongue shaped and we have to practice a lot. And here we used the Lessman stand and the right James stand. For the other tests, we also had the blood coagulation factor test in secondary hematostasis. First one is PT, proton beam time, which is the coagulation factors in intrinsic and common pathway. Then is the activated partial thromboplastin test time or the time test, and we have the coagulation factors in intrinsic and common pathway as well. The biochemistry unit. In this one, the liver function test was done, renal function test, capillary screening, therapeutic drug testing, which is done once a week on Friday using the ECLAIR method. And mainly our work was to get the sample from phlebotomy unit, and all the rest of the tests were being done automatically by the machine. Histopathology. So it's the branch of pathology which deals with the study of diseases in a tissue. So it deals with the study of tissue. Firstly, it starts by crossing. The pathologist cuts the inflamed tissue into smaller pieces so that it can be embedded or made into smaller blocks. And after crossing, they do the fixation using formalin and dehydration using alcohol and clearing by xylene. For the embedding, they use the paraffin wax and make the block, and they cut it and mount it. Then finally stand with H&E stand and report, and the pathologist will check and report to the patient. It took around 2 to 3 months. H&E standing is important in this process because they will help to diagnose certain tissues, and it will be very helpful to distinguish, and it is often possible to make diagnosis based on the result of H&E staining, or it can be determined which special staining techniques are still necessary. So the major step in H&E staining, they are deparaffinization, which is the removal of paraffin wax using xylene. Hydration, we use the graded alcohols to water. Nuclear staining using hematoxylin. Differentiation, acid alcohol, brewing ammonia water. For counter staining, we use the uracil. For dehydration, application of graded alcohol to 100% alcohol were used, and for clearing, xylene was used. We got the stand slides, and under microscope it looks like this. H&E stand of normal skin. Unit is cytology. So histopathology is the study of tissues, right? And the cytology is the study of microscopic appearance of cells for the diagnosis of abnormalities and malignancies, and it involves examining cells taken from small samples of body tissues offers to help determine a diagnosis. And near the cytology unit was FNAC unit, fine needle aspiration cytology. Then inside the cytology had HPV testing, and LBC liquid based cytology was used. And AC, which is the fine needle aspiration cytology, it is useful in palpable lesion of thyroid, lymph nodes, salivary glands, breast, and subcutaneous tissues. The pathologist will use the injection to remove the fluid so that it can be tested further for diagnosis. And mainly FNAC is the study of cellular samples obtained through a fine needle under negative pressure. We will be testing using the liquid-based cytology LBC staining area. First, they start by placing the level BD precord, and they added or pipetted 1 ml of BD density, and they vortex it, and after that, they slowly pipetted 2 ml of sample into the BD setting chamber and place the BD syrup part slice to slide kit, and then remove the BD syrup part direct to the slide kit, and after that they invert the PDCR part. So in order to get the correct staining or the smear preparation, so if you cannot get the sample, for example it is the sputum sample, if you cannot get a clear one, or the urine sample, you can also use the egg albumin. So we use the egg albumin in order to get the perfect smear or get more sample in the smear. So for that one, egg albumin was used, and it was quite nice. After that, if we get positive for HPV, and then for that we have to take it to the genotyping unit for looking at the strands, whether it is HPV 16 or 18. So the strands associated with the higher risk of cancer, we have to diagnose it. And for the process, first started by the viral DNA and RNA extraction, and the next day we did the master mix preparation, and finally the gene expert will read the result in the computer given. Have the microbiology and its units. And first I started in the serology unit, and the test done to detect antibodies against specific antigens, especially in the blood serum. So the tests done were for the HIV, hepatitis A, B, C, scrub typhus, which is caused by bacteria known as Orangia susugamushi, and then for dengue test and syphilis test. This unit is for all these tests. And in the phlebotomy unit, when I went to get the blood valve, it had the VD written, so VD is especially taken in the serology unit. Method used for agglutination test, ELISA test, vaccination test for influenza detection, and rapid test. And there are different kinds of ELISA method. Direct ELISA, in this one there will be direct binding of the antigen and the enzyme leveled antibody. For the indirect, there is primary antibody between the antigen and enzyme linked antibody. For the sandwich ELISA is the heterogeneous method, and there will be step-by-step process, and there will be capturing of the antibody, and the substrate will show the color. And for the competitive one, it is homozygous and all were put together, and there was like inhibitor antigen, and all this process helped to diagnose better. Is the rapid test kit. It is cheaper, it is faster and easy to use, unlike all test kits. So if there is line on the control line and test line as well, it means positive. If it's only on the control line, it is negative. If it's on neither the line, then the test kit is not valid. So you have to check well about the test kit. Pylori are the bacteria that can cause an infection in the stomach or duodenum. Is the most common cause of peptic ulcer. As you can see in the picture, the right picture, if there is presence of H. pylori infection, the color yellow will be shown by the substrate, and if there is no color change, it means there is absence of H. pylori infection. So this is the interpretation of the result. Sputum smears. Then acid fast staining, expert for detection of TB, finding our resistance, and this shows the microscopic of T and the AFP stain sputum smear. For this one, if there is TB positive, they take it to the genotyping unit, and the gene expert will run this machine. And for this one, they will use the sputum for checking your RF testing and transfer it, and after that they insert into the MTB or RIF test platform, and after that they use the ultrasonic lysis, then the DNA molecules mixed with dry PCR reagent, and after that they will run it, and everything, the result will be given by the machine. Using PPD is also being done, and in this one I also got to do this one. And first I started by locating and cleaning the injection site around 5 to 10 centimeter below the elbow joint, and place the forearm palm up on the firm well-lit surface and ask the patient to return after 2 to 3 days and check if there is induration or swelling. If it is more than 15 millimeter, it means it has chances of getting TB. General bacteriology, and the tests that were done were bacterial culture for detection of various pathogenic bacteria and antibiotic susceptibility tests, routine gram stain, urine dipstick tests for UTI detection. And different agar plates used were clade, blood agar, chocolate agar, McConkey agar, and Hackton agar were used for the testing. And first day they will collect the sample, urine or sputum, and they will culture for 24 hours, and after that they dilute it and again make the strip and see if there is growth on the plate or not. If there is growth, it means the patient is positive for the bacterial infection or UTI. I use the crystal violet and keep it for 1 minute. After that, wash it and put the iodine for 1 minute, then wash it and use the ethyl alcohol for 10 seconds and wash it and use the safranin. So for the gram positive, the crystal violet gives the purple or blue color, and for gram negative, the safranin gives the red color. So it is very important for differentiating gram positive and negative, and this stance will also give the background color or help to distinguish the cells and the infectious bacteria clearly. Parasitology, it was fun, but most of the tests were being done in the machine. First, for the test kit, for the pregnancy kit, it was HCG test and used the urinalyzer set for UTI detection, and also the urine test strip or dipstick were used. And for the feces, FOBT, that means the feces, occult blood test in order to find whether there is blood in the feces or not, because all the blood cannot be seen visibly from the eye, so this test is being done. And also the hemospot is also the same function, so both were being done in order to find any kind of infections in the urine or any parasites in the stool. So it was fun and very informative. References I used to study and also for information, I got this letter, the signature, and the information that I did the internship completely. Thank you so much for listening to my presentation. And overall, my internship went very well, and it was nice to do internship in hospital where I can deal with patients and know about different kind of diseases on daily basis. And it was really fun. Thank you so much, everyone.